వినబడుతుందా? గుడ్ ఈవినింగ్ ఆల్. వస్తుంది అది పోయినట్టు. So good evening all. So today topic is pancreatitis and homeopathic approach. Okay. So in this presentation we mainly concentration on pain. So when you are searched that the commonmost toughest pain the patient never face in the life. If you search the Google also, topmost is pancreatitis, renal stones, herpes zoster, and renal calculi. So one of the topmost cases we face to reduce the pain. So whenever the patient get the pain, patient admitted in the hospital, nothing by mouth, at least 1 week. So we face such patients every time they get weekly once or 15 days once, he get a pain, admitted in the hospital. That cases we handle without allopathy support. So never repeated since 7-8 years. So we present that cases, and before that we introduce the what is pancreatitis, what is the causes, how they are related to our drugs. Okay. First, what is the pancreas? So pan means pancytopenia, pan means total. So it is the powerhouse of the total body. Pan means total, creas means flesh. If all the body have a flesh because of this gland, pancreas. So pancreas is the word comes from Greek word. Pan means total, creas means flesh. So if the gland is function is good, every part of the flesh is good. If any dysfunction in this gland leads to emaciation, the first sign in the diabetes, first sign, what is the first sign? Loss of weight, emaciation. That appear in the when your gland working is not proper. So pancreas is a organ, we all know that it is a tongue-shaped organ situated in the second part of the duodenum, have a body, head, body, tails. So head and body mostly related to exocrine function, tail mainly related to endocrine function. Exocrine function is useful for all the metabolism, okay, and give the energy to the body. And endocrine is also nutrition to the total body. That's why powerhouse of the cell. If every tissue is a survival depend on proper function of this gland. So you all know that it secretes the endocrine, exocrine. In exocrine you have amylase, lipase, protease. They are useful in the metabolism, digestion. Okay, exocrine lo insulin, endocrine lo insulin and glucagon. Insulin we all know that is useful for glucose metabolism. Any function proper is there, overproduction or underproduction. Overproduction leads to hyperglycemia, so diabetic. So inflammation of the pancreatic is called pancreatitis. Okay. So inflammation of the pancreatic, two types, acute and chronic. So mostly patients are in acute presentation and chronic in between is there. The acute present, even chronic also there, you have so much pain. Similar presentation of the acute is there. So in acute pancreatitis, what is there in the pancreatitis? So their enzymes reverse flow due to duodenum or gallbladder obstruction causes, and the self over secretion of the enzymes causes autodigestion of the pancreas. That causes inflammation of the pancreas. That condition called as a acute pancreatitis. Okay. The major symptoms in this pancreatitis is violent, uncontrollable pain, pain radiating from epigastrium to back. So, and pain aggravated after eating. Okay. So major causes in pancreatitis is most common cause is gallstones. Second most common cause is alcohol. Okay. And other cause is duodenum. Duodenum also causes inflammation, and reverse flow of the pancreatic juices causes inflammation of the pancreas. So causes mainly gallstone. Gallstone causes ductal hypertension, and alcohol causes excessive secretion of the enzymes, leads to pancreatitis. And so we simple to remember is I get smashed. So idiopathic. Mostly cases we see cases is 1 or 2 cases only related to alcohol. No cases related to gallstone. So mostly cases are related to idiopathic. So gallstones and ethanol, alcohol, and trauma, steroids, over medication, mumps. In this also connection is, so the structural, histological structure of the mumps and pancreas is similar. There is no difference. So enzymes also similar. Amylase, lipase, protease, enzyme similar. But lipase is more secretion by this gland compared to salivary glands. So, and that's why, so one of the book is there, How to Treat Pancreatitis by Farrington and their colleagues, 1868. He also says that simple logic to remember, what are the drugs are admitted towards salivary glands, that drugs also action on similar to pancreas. Simple to remember, because their structures are histologically similar, their functions are similar, their production and metabolism are similar. So that's why in the report also, when you see, so parotitis plus diabetes, you want one rubric in synthesis, parotitis plus diabetes, only one drug there, chonium. So there is, in histological also there are similarity. Our drugs also action on this similarity. Then autoimmune scorpion bite causes scorpion ball ఏమైతుందంటే దాని వల్ల ఏమైతుందంటే it stimulates the acetylcholine. Acetylcholine leads to over secretion of the gland. Then increase the secretion of the juices, causes pancreatitis. Then hypercholesteremia and surgical procedure of ERCP also causes the overproduction of the gland secretion, leads to pancreatitis. So if you observe all the causes, so one of our most common drugs used in practice, it comes in the mind, alcohol and over medication and acute inflammations and abdominal operation. Common drug that comes in the mind is over medication, alcohol habit, nasvamika. So we see the causes also can find drugs. And over logistics also causes the loss of the fluid, causes the over medication of the logistics also causes the pancreatitis. So it's simple to remember, this is the causes. Even basing on pancreatitis also, we remember what are the causes for pancreatitis. So alcohol, polylithiasis, lasix, abdominal surgery, infection, mumps, and scorpion bite and idiopathic. So presentation is epigastric pain, abdominal tenderness and vomiting, general inflammation signs, fever, and tachycardia. Pain related to back. So if you see the repertory, pain, epigastrium extended to backwards. Common drug is conium, nux vomica, calicard. So what are the drugs have affected to pancreas? What are the drugs affected to salivary glands? Affected towards similar. So investigations increasing the serum amylase and lipase. Mostly lipase is most important because lipase is only secreted in the pancreas. And salivary gland lo amylase అక్కడ secreted ఇక్కడ secreted. Difference ఏంటంటే ఇక్కడ లైపేజ్ అనేది ఇక్కడ మనకు ఫ్యాట్ అనేది ఎక్కువ డైజెస్ట్ అయ్యేది సెకండ్ పార్ట్ ఆఫ్ ది డ్యూయటమ్ లో గాల్ బ్లాడర్ నుంచి వచ్చే జ్యూస్ ప్యాంక్రియాటిక్ నుంచి వచ్చే జ్యూస్ వల్ల సీక్రెట్ ఎక్కువ అవుతుంది కాబట్టి మనకు ఎమ్ఎల్ఏస్ కంటే లైపేజ్ అనేది మోస్ట్ ఇంపార్టెంట్. ఓకేనా? ఇది ఎంత రైజ్ అవుతుందంటే మన కామన్ కంటే 5 to 6 times రైజ్ అవుతుంది. అది కూడా 24 hours నుంచి 72 hours వరకే రైజ్ అవుతుంది, తర్వాత ఉండదు. So level of inflammation we know is C-reactive and gallstones other find out with ultrasound examination. City abdomination వల్ల కాంప్లికేషన్ అండ్ క్రానిక్ pancreatitis నెక్రోసిస్ వస్తుందా, తర్వాత ఫ్లూయిడ్ కలెక్షన్ ఉంటుందా, సూడో సిస్ట్ ఫార్మేషన్, యాబ్సెస్ ఫార్మేషన్, ఓకే, అవన్నీ కూడా మనకు సిటీ అబ్డామిన్ ద్వారా తెలుస్తాయి. సో ఇన్ఫ్లమేషన్ అనేది మనకు యూఎస్జీ అబ్డామిన్ ద్వారా తెలుస్తుంది. దాని ఇంటెన్సిటీ ఎంత ఉంది, ఇన్ఫ్లమేషన్ ఎంత ఉంది అని సిఆర్పి ద్వారా మనం ఐడెంటిఫై చేస్తాం. సో కామన్ కాంప్లికేషన్ ఈజ్ acute pancreatitis fluid collection and abscess formation and acute pancreatitis leads to chronic pancreatitis and pseudocyst formation and infections. So chronic pancreatitis acute followed by chronic and viral infections, mumps and influenza and associated alcohol. Okay, chronic pancreatitis compared to this acute is less painful. There is no rise of the amylase lipase. Okay, only structural changes is more predominant appeared in the scan. So causes alcohol, majorly alcohol in chronic pancreatitis, and chronic pancreatitis loss of the function of the lipase leads to malabsorption, causes fatty stools. So fatty stools also there in the iodum and itis versicolor. So they are the drugs are affiliated to pancreas and metabolism. So chronic pancreatitis also complications like acute pseudocyst formation and damage of structure leads to fibrosis and to and reduction of the function of the gland, okay, and reduction of the endocrine function and exocrine function. So endocrine function leads to diabetes. So that is a common complication in chronic pancreatitis. So differences we find that acute low isolated pain and chronic ongoing pain sudden severe ఉంటుంది. ఎలివేటెడ్ ఎంజైమ్స్ కొన్ని డేస్ వరకే ఉంటాయి, ఇదేనేమో నార్మల్ ఉంటాయి. కామన్ కాజ్ మోస్ట్లీ ఆల్కహాల్, గాల్స్టోన్స్. రికరెంట్ ఎపిసోడ్స్ వల్ల వాళ్ళకి అన్బేరబుల్ పెయిన్ ఉంటుంది. మోస్ట్లీ పేషెంట్ మైండ్ గోయింగ్ టు సూసైడల్ టెండెన్సీ డ్యూ టు సివియర్ పెయిన్. సో దిస్ ఈస్ ద వన్ కేస్. ఫస్ట్ కేస్ when I am studying the JSPS PG, the patient have a pancreatic pain since 3 years when he met me. Before that, he consulted minimum 5 to 6 gastroenterologists. One even they done the stunt also. But even pain does not reduce it minimum 1% also. Same pain. Every time he pain, he get hospitalized minimum 1 week. Okay. So he got to the stage that he wants to suicide with pain. When I am pursuing PG in JSPS, he consulted me first time. We take the total case. In this case, before he get a pancreatitis, he have a dispute with his friend. And regarding money, he feels that in mind, he have a deception from friend. So he is intolerance to the ingest and his desire spicy food, no desire of alcohol. He is an angry person. So based on that, we give nux vomica In these cases, we give water doses. Because once pain, when to come, we don't know. How much periodicity, we don't know. Every patient experiences different periodicity. One patient comes every 7 day or every 14 day, every 1 month, we don't know exactly periodicity. Basing on that, we, we prescribe mostly water doses. In water doses, we give 4 pills in 1 liter bottle. So shake before every time we take. In acute pain, we repeated first hour every 5 minutes, followed by every 10 minutes, followed by every 30 minutes. Then every 1 hour, 1 day. Mostly 1 day we get the relief of the pain. So followed by infrequented, every day 3 times, every day 1 time, every day. So then after resolve the pain, we give weekly doses. And every month we go on increase the potency. So because what our master said, when you want does not get a recurrent of the pain, go on increase the potency. What Ken said in the what are the cases we can succeed in lacerating, we can see. Every 2 months we go on increase the potency. Because hypotensis వల్ల పెయిన్ అనేది రికరెంట్ కాదు. సో లోపటి వల్ల ఏమైందంటే పెయిన్ అప్పుడు సబ్సైడ్ అయినా ఎప్పుడైనా పెయిన్ సెకండ్ టైం వచ్చే పెయిన్ సో మోర్ సివియర్ దాన్ ఫస్ట్. వి గో ఆన్ ఇంక్రీజ్ ద పొటెన్సీ అంటిల్ ఎగ్జాస్టెడ్. అప్ టు సేమ్. సో ఆఫ్టర్ దట్ అరౌండ్ 6 months we stop the total medication. And all the patient does not get even single pain. If you stop in one potency, 200 mm, we get the recurrence. Patient more go to the suicidal tendency and more going to depression. So we observe that first time pain is compared to second time is more severe, third time is more severe. He is going on unbearable. You go on to going to stage of depression. So that's why we mostly succeed these cases on water doses. Okay. In this case, we take the total case. So we take the deception, first rubric, elements of deception, pancreatitis severity, and injustice intolerance. We get Naxwamica 200 water doses. First month we give 200. Only one time we give 4 pills in 1 liter bottle. Go on adding. Second time, 4 pills only one time. So go on increasing until 1 month. Okay. So we take the elements from deception, injustice, can't intolerant, pancreatic elements, aggravation, eating after. We also getting a cramp. So we get Naxwamica. So we give Naxwamica 200 water doses followed by 1 m, 10 m, 50 m, cm. Then after this, since 8 or 9 years, he does not get a single pain. This is the patient.
నమస్తే అండి అందరికి. నాకు 2008 బయటపడ్డది. కానీ ఎన్నో హాస్పిటల్ తిరిగాను. కేశవల అండ్ గ్యాస్ట్రోఎంట్రాలజీ, ఏషియన్ గ్యాస్ట్రోఎంట్రాలజీ, చాలా హాస్పిటల్ తిరిగాను. కానీ ఎక్కడా నయం కాలేదు. చాలా టాబ్లెట్లు వాడాను. ఒక 3-4 సంవత్సరాలు టాబ్లెట్ వాడిన తర్వాత నేను సర్జరీ చేయించుకున్నాను. సర్జరీ చేయించుకున్నా కానీ నాకు విపరీతమైన పెయిన్ వచ్చేది. పెయిన్ ఎప్పుడు తగ్గపోయేది. మేలుకే ఉన్నంత సేపు ఎప్పుడు వస్తూనే ఉండేది. కానీ అనుకోకుండా భాస్కర్ సార్ని వచ్చాను. వచ్చిన తర్వాత సారు మంచి మెడిసిన్ ఇచ్చిండు. ఎప్పుడైతే ఆయన మెడిసిన్ ఇచ్చిండు ఆ రోజుకెళ్ళి నాకు పెయిన్ అనేది రాలేదు. కాకపోతే అలోపతి టాబ్లెట్స్ వల్ల కొన్ని వీక్నెసెస్ వచ్చాయి. దాంతో చాలా రోజులు ఇబ్బంది పడ్డాను. చాలా రోజుల తర్వాత 2011 భాస్కర్ సార్ అప్పటి నుంచి ఇప్పటి వరకు ఎట్లాంటి నొప్పి, ప్యాంక్రియాటిస్ నొప్పి రావటం లేదు. చాలా మంచిగా అయింది. థ్యాంక్ యూ.
So this is my first case. He gave the boost up to the treat the pancreatic patient because I know how many times he get a pain, how much pain he get, how much medicine we repeat. So every 5 minutes we repeat up to till midnight. Then when he get a relief the pain, we get the sleep. So because we know that how much pain he get every time we see the patient. Since 12 years I see this patient. After 8 to 9 years, we never get a single pain. We stop the medication. We stop the only use the medication 6 months. We stop the medication. You never give any drug in between. You never get a recurrent of the pain. So, because what has been said in 6th edition, water dosage, there is no more dry doses on this edition. So, because he said he also observed that when he gives the medication, when he stop the medication, he gets the recurrent of the symptoms. So we go on navigate, we find the chronic diseases, chronic causes, fundamental miasm. But even also that repetition also gets the pain. When we go to the millismal, in millismal, when he see the results, he said he confirmed that it is the last method of my dosage method. So millismal, he used the millismal, but we use that in centesimal water doses. Okay. Then this is our second case. He is by profession he is a degree lecturer. He also get the pain from since 2-3 years. He is from Peddapalli, Karimnagar. So he have a pain that acute pain. When he get acute pain, in knee elbow position he get the relief. The only first symptom we get this from this patient is whenever you have acute pain, he get knee elbow position, he gets the relief. That is the only symptom we find. In the total history, he is taking, did not find any emotional causes, any specific desire, anything. Based on this, only 2 symptoms, acute pain and knee elbow position relief. So we are in the dilemma. Only 2 symptoms are available. So that is time I am happy to read Lilienthal. We go to the Lilienthal, see the pancreatic chapter. Acute pancreatitis. He gives the remedies chronium. We never think. Acute pain. Chronium is chronic, glandular, everything. But in acute pain, in modality also, the pain relieved by knee elbow position. So basing on that, we first prescribe the chronium 1 m water doses. Every time we get a pain, he call me, we make a kit, all the pancreatic drugs, iris, atropine, and so whenever they get a pain, basing on modality, basing on pain radiation, basing on severity, we suggest this, take this medicine every hourly, every 5 minutes, mostly 2-3 hours he gets the relief. So every time after that pain, first time he relieve the pain, every month, every 2-3 months, every 1 year, every 2 years, followed by 5 to 6 years, around 5 he never get a single pain. So we stop the medication, chromium, in between you give acute pain, you give atropine salt. Why we select the atropine salt, we told that. So basing on severity, basing on pain modalities, basing on associated symptom of that time, we select the, basing that we change the remedy. Okay. So acute pancreatitis with nausea, vomiting, pain extending to back, emulated by bending forward, knee elbow position, chromium 1 water doses every hourly, up to reduce the pain. So then make a kit, different drugs, because he is there from Karimnagar, I am there in Nalgonda. So when he get a pain, so difficult to manage. So most problem is whenever he get a pain, we admit the hospital every time, every 1 week he get a pain. Every time at least one week he admit in the hospital. Every time at least 30 to 40,000. Wherever he is a contract lecturer in the degree college, so only get to 20,000. Every time pain he get to 40,000. Okay. Video. So based on these two symptoms, acute pancreatitis and knee elbow position, emulation by knee elbow position. Okay, we select we generally never think of the chonium as a acute pancreatic drug. So what our master said, homeopathy is nothing but science of therapeutics. The only science of therapeutics in the earth cure from acute infectious disease to cancer, even surgical cases. That's why Dunham write a lesser writing book, Science of Therapeutics. Why? What is homeopathy? Homeopathy is nothing but science of therapeutics. But we never see that therapeutics we look like as a something different. We think as a constitution drug. Constitution drug like a IPL or a cricketer get a century. Every time you never get a century. So constitutional drug is available to the patient out of 1,100 cases, because Dr. Margaret Blocky, Dr. Edward Whitman, he said, when we have 25 years practice, we see all our successful cases or failure cases. What he observed that, what are the successful cases are less than failure. So because what is their conclusion is, we never give a acute remedies in between the constitutional drugs. That is our failure, causes for our failure. So we are same situation we face in our practice. So we think that when you give a constitutional drug, it covers everything, but it never, sometimes it reduces the pain, not every time. Okay. You see that it radio. So what he explained that he get a pain in the abdomen, erection to back. he he suffered since 7-8 years. So from 7-8 years onwards, after stopping medication also, he never get a single pain. So this is another case. So we take this patient is, so whenever he get a sleepiness after eating and eating evaluation the pain. So F2 pancreatitis pain, nature of the pain is burning. Based on that, we select the phosphorus. Phosphorus, 1 m water doses. So sourpuss aggravation, burning pain, pain emulated by eating. So in followed by acute, in when acute pain, you give 1 m every water dose every hourly, every 5 minutes, based on severity. We follow this case up to 1 year. After 1-2 months, the patient never get a single pain. So this is another patient. So he also sensation of the pain is sore bruise, pain related to back. His nature is anger and dreams of snakes. So we take the total repatriation. Dreams of snakes is there in the iris versicolor. So based on that, sore bruise, ability to pancreas and pain, sore bruise is hypochondria, pain extend to back, constipation, bowel, dreams of snakes. We select the iris versicolor. So this is the iris color 1 m water dose every hourly. So same method. Every time we use water doses in acute every 5 minutes, followed by every 10 minutes, followed by every hourly, up to reduce the pain. So based on anger and violent anger and pancreatitis. So we give kali iode because so autodigestion is the syphilitic mechanism. Mostly our drugs, what are the effects to pancreas, we see the syphilitic nature. Knowingly, unknowingly, kali iode, merxal, atropine salt, iodum. So all are syphilitic nature. So this is the only one case we see the alcohol patient. All the above patients, you never see the single alcohol habit. So based on patient complaints in the facial edema, sensation of heaviness, abdomen, and mucus stools are black in color. As a person, frivolous nature, because even though you have a serious disease, it does not reduce the alcohol drinking nature. So basing on that, so facial edema, he also have a jaundice previously, distension of the abdomen, dipsomania, pancreatitis, frivolous, mucus stool block in nature. About that, merxal. We select the merxal. So merxal we give in water doses. After 6 months, it totally relieves all the complaints. So no recurrence of the all complaints. So this is same in this case. Causation is element from financial loss, as a nature, anger person, anger and contradiction, perspiration on the nose, pain in the hypochondria associated with nausea. Basing on the total, so we get the Naxwamika. So financial loss. So basing on that, we give Naxwamika. So element from financial loss, anger, contradiction, ability to pancreas, perspiration on the nose. So same method, Naxwamika 1 m water dose. So in this patient, crampy nature, forward bending emulation, anger, desire spicy, perspiration on nose, talk indisposed. So Naxwamika, followed by anger nature, and you get a arsenic. So total picture and iodic gland ability also had be given. So infrequent doses after reducing of the acute pain. If this patient have headache also, and as a nature patient is introverted, so headache, general perspiration with headache, constipation with headache, F2 pancreas, introverted personality, scalp The forehead, perspiration, headache, bloating. We take as a concomitant headache, forehead extend to occiput. Basing on that, we give conium. So total disease. So mostly when you read the conium and nitromore, mostly similar. When you read all the books, total mentality and affinity, everything is similar. When you repertorize the case, wherever nitromore is come, we get some other 1 or 3 later drugs, we get conium. We observe that. Same observed by some other master is belladonna and laxis. When you see the repertorization, the case comes and total to belladonna, we see some other drug laxis nearby it. So you will learn from this repeated repertorization. So in this case, we never give nitromore. Introverted, even introverted is covered by conium. So conium is given water doses. So this is the ampulla, CF ampulla. He had operated, but he is mostly pain after eating, and he also have a prostatomegaly. This is the only palliation. After 3 months, patient died with. This is the extension of the metastasis of the cancer. So be it cancer, pancreas, prostate gland, pain, aggravation after eating. Okay, urination frequent, prostate enlargement. Basing on that, we select the conium. He gives conium, patient gets the relief, but already cancer operated, even though they are metastasis. Based on that other causation, he only done the palliation. He died with the extension of the progression of the disease. Then adenocarcinoma with pancreatic calculi. This is the case when you are working in the CCRH. This case. So the patient is typical appearance of the phosphorus. Tall, lean, is highly is talkative, is so we give phosphorus, even though we start with low potency. He survived with 6 months. After they operation for stunt to obstruction of the pancreatic duct. So progression of the disease and biopsy, we identify that adenocarcinoma of the pancreas. After 5 months, he died because we see that total pancreas, meaning when you see this patient, he totally emaciated, pancreas, loss of all flesh. We see, so pancreatic, what is the pancreatic causes the patient in external appearance? Typically our phosphorus appearance. So we mostly divide into drugs in homeopathy management, drugs, medicine and remedy. Drugs is an organopathic drug. And medicine is proving drugs. Remedy is those medicine cure the permanent of administration of the medicine. This is a protocol formed by Dr. Biju Kerala. He used so many drugs, so many methods. He treats so many patients. He treats around 1,000 cases of hepatitis B with homeopathics. All are negative. Dr. Biju, his book are available, we read it. So he used this method. Every case use the drug, organal drug, followed by medicine, followed by remedy. We form a protocol, every disease protocol. So when you want to prescribe in acute, our drug, we know that our drug is more related towards target organ. So when you form a material medica, so our drug 100% target oriented, acute. In chronic target oriented, there is no problem. In acute, if drug is not target oriented, patient does not get the relief. So in our poisoning of the iris and iridine active principle, they find that stimulates the pancreas vasculature and produce the hemorrhagic pancreatitis in dogs and cats. Experiment. So our drugs are acting how much level? Hemorrhagic pancreas. They produce hemorrhagic pancreas. Then we have confidence that our drugs only symptomatic without animal experiment, we never get a confidence. We are acute. Our main focus is our remedy mostly target oriented. Organ affinity is perfect 100% organ affinity. Based on totality, we select. Okay. So they find that in the dogs and cats, they injected the iridine, active principle of iris. They find that which causes bursting of the micro circulation of the pancreas leads to hemorrhagic pancreatitis. That is an animal experiment. So iris versicolor is vegetable Merxal. In going to the Dr. Franz Wellman Prisma, he said that there is no difference between Merxal and iris, except the discharges are Peter and destruction of the, that much of destruction is not there in the iris. That is the only two differences. Okay. So in iris, one of the concomitant is burning from mouth to anus. You go to the Pathak, abdomen chapter, first chapter, burning intestine, whole intestine, only one drug iris. So the main, similar in that area, burning in a affected area, similar to phosphorus. And excessive salivation and affinity to salivary gland, affinity to pancreas, over secretion of the discharges equal to Merxal. So that's why he called vegetable Merxal. We know that Podopolyme is vegetable Merxal. We know the vegetable is vegetable Merxal. We know Caliod is mineral analog of Merxal. Iris is also vegetable Merxal. So it also produces the fatty stool. Like iodine and these drugs mostly produce the fatty stool because the assimilation defect of the fat in second part of the duodenum. So the malabsorption leads to fatty stools that are present in the iris versicolor and iodine. So, what is the difference between Merxal and iris? Great fetor and destructive ulceration of the mechanism. That is the only difference. So, the Dr. Sarabhai Kapadia done a wonderful research on iris versicolor. When investigation, you find eosinophilia, he give iris versicolor. Every patient. Read Dr. Sarabhai Kapadia book, My Homeopathic Reminiscence book. He cured so many cases with iris versicolor. He found a monograph iris versicolor. So he give wonderful case. A patient has psoriasis, basing on observation while talking, salivation while talking. We can in the repertory lachesis, graphaitis, iris versicolor. In Gori, silvery scaly eruptions on elbow and knee. In Canterbury also, psoriasis in elbow, psoriasis in elbow, only iris and phosphorus. So basing on affinity, basing on excessive salivation while talking, he prescribed iris. So he done a monograph on iris. He even eosinophilia in the investigation, CBP also he prescribed iris. So continued burning in the affected area is the indication of the iris. So iodine. So iodine also, atropine, iodine and spongia. These are three drugs are organ drugs. Everything more on pancreas. So generally we think, as per Redimisher organopathy book, iodine is a organic remedy of the pancreatic. Because it causes the acute congestion and increases secretion, followed by atrophy organ. So congestion, acute pain in acute pancreatitis, and atrophy of the gland and hardening of the gland, chronic pancreatitis. Is it a drug useful in both stage? So whenever iodine fails, he give atropine salve. So why atropine salve? We give in acute pain mostly as an organic drug in atropine salve. Why I tell you? So in class prescriber, we see only 4 drugs. In bracket, he give 2 hours, 4 hours. So we read all the master's domestic physician books. He changed the drugs in 8 hours. We read Herring, we read Clark prescriber, every master's lesser writing also. In acute, he changed the drugs in 8 hours. We give single drug, wait, hourly, days, months. See, even these give Caliod 4 hours. Works are 6 hours. He give acute, we prescribe in hourly. So, fatty stools we give iodine. So, phosphorus, we know the more appearance also look like a pancreatic patient. So belladonna also acute pancreatitis, hemorrhagic pancreatitis they produce, but belladonna కంటే మనకు atropine self get the more result in acute. So conium already said acute pancreatitis, sudden attack, the vomiting and pain relating to the back. Okay. And so this is the rubric, diabetes mellitus accompanied by parietal gland swelling. So their histological structures are similar, their secretions are similar. That's why homeopathy management pancreatitis by Farrington, some of their colleagues, he said whatever the drug affinity on salivary glands, they are also affinity on pancreas. So why atropine self? So this is from herring symptom. Whatever symptom you take, great pain, anxiety, what is the clinical condition? We give theta. In herring theta means clinical condition. We give pancreas, disease of the pancreas. Headache, great weakness, disease of the pancreas. Suffering appearance without great wellness. What is the cause? And whatever condition we see, the disease condition is pancreas. So this is all from herring see. So every symptom, whatever symptom, even vomiting, pain, patient does not like to eating because of pain. So every clinical picture, every symptom of pancreatic present in atropine self. So vomiting, like a wash, meals తీసుకున్న తర్వాత 5-6 hours తర్వాత మళ్ళీ వామిటింగ్ అయిపోతుంది వాళ్ళు. సో ఆ భయంతో వాళ్ళు ఫుడ్ తీసుకోలేరు. సో వాట్ ఎవర్ సిమ్టమ్, డీప్ ప్రెషర్, న్యూరాలజియా, పెరిటోనియం and much emaciation from gastric disorder. So that is a common presentation in pancreatitis. So that is all symptom from mind to total body covered by atropine self. So whenever a patient severe acute pain does not be relieved by indicated remedy, give atropine self, we get 100% results in especially acute pancreatitis pain. So spongia also organic remedy because affinity to pancreas, and it also contain iodine. So iodine causes acute inflammation, secretion of the juices, congestion of the juices, and followed by atropine spongia. Okay. So first we give clinical case, we first follow. If totality is available, we go to the classical or constitutional. Mostly we go to the clinical. So first clinical, first get a patient confidence first and reduce the patient suffering first, then followed by constitutional drug. Okay, then only nowadays so many pain clinics are there. They give one injection, patient does not get pain in 6 months also. So patient does not, nowadays patients are impatient. Patients are, even to get the headache, no. After one drug we take, does not get the relief, we take the second dose or third dose, then we take a painkiller. So patient wait, so patients are greater than ours. They are more patient than ours. Okay. So what is our observation? Say read Materia Medica. What Anvil said, fidelity while taking the case, fidelity while reading the Materia Medica, fidelity while prescribing acute prescription, especially in acute pain. So our pathogenic symptoms of the drug and affinity and their aggravation amelioration 100% match, like a herring three-leg stool. So this is another topic. We read Materia Medica in so many ways, like different masters. So we read one way, we miss some cases. So we read different mode of different way of Materia Medica from different masters. So what J.H. said, as our institutions are, so are our people. So our juniors, so many people ask, why in medical college they give only 3 doses? So there is no ardent rules, only flexible. Every master prescribe homeopathy in different ways. So homeopathy is a win because of defective books and defective use of the books. Both there. This is from Kent Lesser writing. Kent Lesser writing. Homeopathy failures because of defective use of books. If in acute pancreatitis, I never read Leonthal, I never get a cholium prescription, even though repertory chart you get. So that depends on if you read more books, we know that. So what is the importance of reading of herring guidings? In herring guiding, a boy aged 1 year, the presentation is diabetes mellitus. A boy aged 9 years, presentation is diabetes insipidus. What is remedy? This is the case, not from it is from herring guiding. సో హెరింగ్ హెడ్డింగ్ లో మొత్తం 48 హెడ్డింగ్స్ లో ఆయన మెటీరియల్ చదువుకోండి. 48 హెడ్డింగ్స్ లో ఒక హెడ్డింగ్ లో లైఫ్ అండ్ స్టేజ్ అండ్ కాన్స్టిట్యూషన్ హెడ్డింగ్ ఉంటుంది. చాలా మంది మనం అనుకుంటాం మనం ఇచ్చేది కాన్స్టిట్యూషన్ ప్రిస్క్రిప్షన్, మనం ఇచ్చేది కాన్స్టిట్యూషన్ ప్రిస్క్రిప్షన్ కాదు. ఇఫ్ యూ రీడ్ హెరింగ్ లైఫ్ అండ్ స్టేజ్ అండ్ కాన్స్టిట్యూషన్, వీ నో దట్ వాట్ ఈస్ ద కాన్స్టిట్యూషన్ ప్రిస్క్రిప్షన్. సో మోస్ట్లీ వీ ప్రిస్క్రైబ్ క్లాసికల్, నాట్ కాన్స్టిట్యూషనల్. సో what is the remedy? A child 1 year age suffering with diabetes, a child 9 years suffering with diabetes insipidus. We never think. So there is even patient with juvenile diabetes does not get any symptom. So we never think that drug. So the drug is Podopelum. So in herring, life and stage and constitution, we read this there in the herring. We never think that Podopelum is a diabetic drug. So so many people said we think that we give constitutional remedy. We never give constitutional. We give classical. What is the classical? Available totality is nothing but classical. Available totality is nothing but classical. Available totality with the history of present, age, sex, past history, occupation, lifestyle. Everything is match is the constitutional. So ikkada age untidi, tarvata disease match ayindi. So we never think about Podopelum. So we all know that knowledge of the disease, knowledge of the medicine, and their proper dose and proper repetition also. Proper period of the repetition of the doses, proper dose. So that's why Hahnemann, you see the failures and he go on change the potency. You go to the last millimolar. He is satisfied because up to reduce the pain, we give every day 3 times or every 2 hoursly, every hourly, every 4 hoursly. You mentioned in the chronic disease, you mentioned in the organon, that you every 4 hours, every 2 hours also, every 2 minutes also, 5 minutes also, repeat the medicine. So generally, we never think that meteorologic bureau mind symptoms, no? So anger, we generally think of nux vomica. What is there in the anger bureau? We see that. We know the primary action, secondary action, secondary curative action. So what is there? That is only present in the meteorologic bureau. No other meteorologica does not explain regarding primary symptoms, secondary curative. So when patient comes in the 2 poles, either in positive mental state, cheerful, spriteful, talkative, jovial. So this is the appearance. Another is depression, loathing, apathy, introverted. So this, see the total opposite is activity, briskness, mind, sadness, cheerful, confident, low confidence. There is a 2 pole. This is a, what is it? It is a curative action. It is a curative action of the vital force, secondary curative action. So what Angostura do in the mental level? It stimulates the briskness, activity of mind. So we go to the relationship, kinship of the BBCR. We give so many relationships. We don't understand that. So in this area, Angostura complementary to opium. Blissful, cheerful mind. So that is the stage produced by Angustura vera. Similar. So this is a constitutional prescription cover every patient, occupation, age, mode of living. So if this all covered by drug, then only it is a constitutional drug. So let ball also, we never think let ball, it is angry disposition, appearance is cheerful and gaiety, calm disposition, love for work and self-content. So content person, content disposition, we get opium. We never think of let ball. So one patient, a concomitant patient, whenever they have a flatulence, they have a palpitation. So when we search this, we get calcareous. What is the calcareous? Is useful for all the stage of the life, from climactic, child, and alcohol people, and reduce the inflammatory production of the veins. So every stage. So that's why they give age, stage of the life. So every drug, different stage, different age peoples, different problems. So based on occupation, tailors. So we give so many cases anacardium. So when burning acid, thigh anterior part. What is the anterior part of the thigh covered by muscle is sartorius. Sartorius is a muscle of tailors. So affinity, they give anatomical also. We never think. We prescribed so many patients, occupation, tailors. Common symptoms is pain in the cramp, mouth muscles, and gastric disorders, constipation, bowel. In lesser writing and manual said, the worst occupation in the earth is tailor. He said, because he get every disease, cervical spondylosis, piles, gastric disorders, muscular disorders, everything. That's why he write in lesser writing, worst occupation in the earth is tailor. So based on a mode of living, we select the medication. So minus, causes marriage, nitrogen, sulfur. So occupation, their mode of living. So we will think intellectual person, chimopilla. So intellectual people, mild yielding, we think of some other drugs, but we never think of chimopilla melita. So even it is good from male alcohol habit, abdominal renal dropsy, female EC, mother of the patient also cirrhosis of cancer of the breast, we think conium. We never think of chimipilla, family history of the cancer. We only think of conium, some other drugs. So this is from hearing, all the hearing guiding, life stage and constitution. We read what in that stage, he give their own experience. What is the basis for their prescription? In as per constitutional base. Domestic also, domestic problems, domestic depression, and domestic tension, diarrhea from domestic tensions, copia cruda. Sedentary habit, different drugs, sleeplessness from peculiar loss. We give one case, Stanamet, basing on this symptom only. We get the patient 100% better, we totally better for all those complaints. Sometimes one single causation, one single also cover the totality. So, basing on gangrene, hospital gangrenes, minister sore throat, hospital sore throat, hospital sore gallimure, hospital gangrene, sisters canadensis, minister sore throat, colon surgery. We prescribe one patient, minister have a recurrent cold and cough. We give so many remedies. When we go to the hearing addicts, we see that minister sore throat. So drugs whatever there in the day book, we compare the different provers and take the anatomical affinity. Like If 23 observation of the pickup, 17 indicated the primary action of stomach, followed by respiratory, followed by cardiac, followed by gastric. In that area, similar proving లో యాంటీబాడీ టాట్ ఉంటుంది. సేమ్ ఎఫినిటీ, సేమ్ ఆర్గాన్ ఎఫినిటీ ఉంటుంది. అందుకే ఇపికాకు యాంటీబాడీ టాట్ కాంప్లిమెంటరీస్. ఎందుకు కాంప్లిమెంటరీస్? ఇన్ ద ప్రూవింగ్ ఆల్సో దే హ్యావ్ ఎస్ ఆర్గాన్ ఎఫినిటీ ఇన్ ద ప్రూవింగ్ సేమ్ సిమ్టమ్స్, సేమ్ సెట్ ఆఫ్ ది సిమ్టమ్స్. ఫస్ట్ స్టమక్, followed by respiratory symptoms, followed by gastric symptoms. Same in the Naxwamica. We never think Naxwamica physostigma as a complementaries. In the proving, first cutaneous symptom, spinal symptom, respiratory, mental. This is from Woodward Constitutional Therapies book. Wonderful book. We never read. When we read this only, we know the complementaries. Naxwamica get a complementary to physostigma. We never think in physostigma is a Naxwamica complement. So opium, camphor, they are all from original provings. రిచర్డ్ యూజెస్ సైక్లోపీడియా నుంచి ఆయన ఏం చేసిన రిపీటెడ్ ప్రూవింగ్ చేయించి 15-20 మందిని తీసుకున్న ఆర్గాన్, ఏ ఆర్గాన్ ఏ ఫిట్ అవుతుందో తీసుకొని సిమిలర్ అట్లా ఆయన ఓన్లీ 50 డ్రగ్స్ చేశాడు, మిగతా డ్రగ్స్ చేయలేదు. సో పల్సటిల్లా లైకోపోడియం, కార్బోలిక్ యాసిడ్ జింకమేట్. వీ నెవర్ థింక్ కార్బోలిక్ యాసిడ్ జింకమేట్. సో ఎపిస్ అండ్ డిజిటాలిస్ both have a prostate ability, both have a liver ability, both have a membrane ability, cardiac ability, edema. So when we think epispalis, we think of digitalis. So sometimes ascending nature. So extremities pain, stitching, heel, extending to upward. One case, disc problem, we give basing on the symptom Phytolacca. We never think Phytolacca in these symptoms. So sometimes patient even order of the direction of the pain also important. So heel nunchi ataniki ippavaru vastundi pain. We never think. We blindly search, see the Phytolacca. We never get a pain only which is 6C 1 week followed by 8-9 years. You never get a single pain. Yes. Happens. So in even nosodes also, we go to the nosode ambracracia from Lippi, we total report is the lower limb ability. Out of 30 rubrics, all covered by ambracracia. Varicose vein of the lower limb, cramps of the lower limb, heel pain of the lower limb, ankle pain of the lower limb. We generally report right. We get ambracracia. We never think. Ambracracia is a drug for one-sided complaint. When a patient get a one-sided complaint, we think of ambracracia. And tend to give a wonderful picture that one old man, he get a vertigo, he does not relieve by any remedy. He give ambracracia, get a relief. Then he give you undescriptive vertigo. Patient get only one symptom, vertigo. He never said any at all. Either rising from bed or right side, left side, we never get any symptom. In that case, one-sided cases, we think of ambracracia. So why I am saying water doses and hypotenuse are most valuable according to Boningason. Boningason done a wonderful research. When you read the lesser rating of Boningason, he said only experiment with potency. Everyone have problem with potency, no? He done a wonderful research. First 3 months, what he blindly give, every patient give 30. Whatever complaint. 3 months, he see the result. Then next 3 months, he give 200. Then third 3 months, he give 1M. He observed that last conclusions are high potencies are act more powerful than lower potency. That is the conclusion. So what he said, value of high potency, higher potency seems to offer means more assimilate, more the receptive organism. organic power, receptive is homeopathically more effective. Beginning is of hypothesis really attend to observe, have experience that they require no repetition evidently, but division of doses in a solution of water. If this shaken before give, may admitted. So if you water dose ఇస్తే ఏమవుతుందంటే సో మోర్ అబ్జార్బుల్ ఉంటుంది, సర్ఫేస్ ఏరియా మోర్ ఉంటుంది, అబ్జార్బుల్ అనేది ఈజీగా ఉంటుంది. సో అప్పుడు డ్రగ్ అనేది రిసెప్టివ్ పవర్ పెరుగుతుంది. సో దానికి ఆయన కూడా బోనింగాస్ సిస్టమిక్ రిపోర్టింగ్ లో ఇంట్రడక్షన్ లో ఇస్తాడు. కొన్నిసార్లు మనం ఇండికేట్ డ్రగ్ ఇచ్చినా డ్రగ్ పనిచేయదు. ఎందుకు పనిచేయదు అంటే ఆయన క్లియర్లీ ఎక్స్ప్లెయిన్ దట్ రిసెప్టివ్ పవర్ ఆఫ్ ది పర్సన్ ఈస్ నాట్ recepting that drug. This concept there in the allopathy also. They give citizen to one person, work to some person liver citizen, some person liver citizen monoliths. So all are the same, but sometimes work, sometimes does not work because of receptive power is less to that person that time. So అందుకే ఆ రిసెప్టివ్ పవర్ లేదు కాబట్టి ఆ మెడిసిన్ వర్క్ చేయట్లేదు. సో ఈ రిసెప్టివ్ పవర్ అనేది నువ్వు వాటర్ డోస్ లో ఇచ్చినప్పుడు ఆర్గానిజం రిసెప్టివ్ పవర్ తొందరగా రిసీవ్ చేసుకుంటుంది కంపేర్ టు డ్రై డోసెస్ ఇచ్చినప్పుడు. అందుకే 6th ఎడిషన్ లో హ్యాన్మన్ ఏం చెప్పిందంటే నో మోర్ డ్రై డోసెస్ ఆన్ దిస్ ఎడిషన్. ఎందుకు? సో నీకు సర్ఫేస్ ఏరియా నాలుగు, ఇప్పుడు మనం డ్రై డోస్ వేసేసినప్పుడు ఓన్లీ టంగ్ మీద ఇస్తాం, ఓన్లీ వన్ సర్ఫేస్ ఏరియా కవర్ చేస్తుంది. వాటర్ డోస్ వేసినప్పుడు లార్జ్ సర్ఫేస్ ఏరియా కవర్ చేస్తుంది. అప్పుడు రిసెప్టివ్ పవర్ ఆఫ్ ది డ్రగ్ అనేది పెరుగుతుంది. సో అందుకే ఆయన ఏం చెప్పిన వాటర్ డోస్ లో ఇవ్వండి, డివైడెడ్ డోస్ చేసుకోండి. ఒకసారి వాటర్ వేసిన తర్వాత ఒక దాంట్లో నుంచి ఒక 10 ml తీసుకొని ఆ డే వరకు రిపీట్ చేయండి. దిస్ ఈజ్ మోస్ట్లీ ప్రదీప్ గుప్తా సార్, మైమినాథ్ హోమియోపతి మెడికల్ కాలేజ్ ఉంటుంది. వి సీ ద సార్ కేసెస్. ఈ వాటర్ డోసెస్ ఇఫ్ మేక్ ఏ సొల్యూషన్, టేక్ ఒక 10 ml ఫస్ట్ 1 hour every 5 minutes, then every 1 hour. He mostly acute cases he treated. We have live videos are available in SAR. Dr. Pradeep Gupta, Naimnath Homeopathy Medical College, Agra. We give water doses. Every cases he give water doses. He give wonderful acute cases. Manage with water doses every 5 minutes, first hour. We learn from that master. We give every 5 minutes, first hour, followed by every 30 minutes, based on severity. Okay, that is the secret of the water dose concept. Okay, water dose causes increase the receptive power of the organism. So that's why the results are more prominent, more acute, without aggravation. Okay, thank you.
Thank you so much, sir, for such an elaborative and knowledgeable session. I guess sir needs a big round of applause. I guess he deserves it. Now we have 2 presentations by STSH winners of CCRH, each 10 minutes. So first will be called upon Dr. Visnavat Pujita Raj. She was selected in STSH CCRH for the topic to study the efficacy of homeopathic medicines in management of post-dural puncture headache caused after surgery due to spinal anesthesia. Welcome her with a big round of applause.
I would like to thank you, team HMAD, for giving me this opportunity to